We have Dr. Abiola Buremoh, a consultant psychiatrist who joins us from Abuja, Nigeria. Dr. Abiola Buremoh, thank you very much for your time. The circumstances surrounding the death Thank you. The circumstances surrounding the death of Mohbad is quite puzzling to a number of people out there. Tell us how convenient and accessible is it for people to get, how easy is it for people to have access to hard drugs in Nigeria?
Unfortunately, it's way too easy. You can go to pharmacies these days and ask for whatever medication that you want without even a doctor's prescription. So we even have vendors on the street who hawk some of these medications that have no business being on the street. We've seen a decay in that system in regulating the availability of medications. So yes, it's very, very accessible, very, very available these days, and it's really sad.
Interesting. What are the processes involved in getting these medications in the country, Nigeria?
Okay, so I would say the ideal thing, what's supposed to be the right thing is if an individual has certain complaints, feeling a certain way, person is supposed to go to the nearest clinic, be assessed by the doctor who would run investigation, and based on both clinical observation and the test results, can now make an informed decision that is making a diagnosis. And then there is a prescription, which the individual, the patient now heads to the pharmacy and the medication is dispensed. But what we have these days is someone has some symptoms and just goes to the pharmacy. And sometimes you don't even have a pharmacist in the pharmacies, just maybe an attendant who would, out of maybe observation from the professionals, would make their maybe advise the individual on what to take. So we are not seeing so much of the right process being followed now. People don't like going to the hospitals, but like I said, that is how the process should run. But we don't have that really, operational for now.
How do people, who are not qualified to offer medical services get access to these medications, in a way that can enable them wrongfully administer same to unsuspecting patients?
Currently in Nigeria, we run the open market system for drugs. So you see, if you're just a business person, you can be involved in purchasing medications on large scale, can even open a pharmacy, even though for the pharmacy council, there are 1 or 2 regulations. But, well, the thing is, people can just walk to a pharmacy, especially those who in areas where the regulatory bodies are not, going around to make sure and enforce that the right thing is done. So people can just walk into the pharmacy, request for ABC, which are ideally prescription-only medications, and these medications are given. And in fact, we have cases of where individuals can go. The attendant knows that these medications should only be given with a doctor's prescription. But if the person can, pay some extra money, they can have access to those medications. So we have people being money driven rather than following the right procedure to do what is right. So yeah, like I said, people who are not trained, who don't have the license to prescribe or administer this medication can easily just walk into a pharmacy, ask for XYZ, and it is given without queries.
Regulating the practice of medicine and indeed of nursing in Nigeria that you think we should take note of?
Yes. So really, well, the healthcare system is regulated by the National Health Act of 2014, but individual professional bodies, different professions have their professional bodies that regulate them. So say, for example, for medical doctors and dentists, we have the Medical and Dental Council of Nigeria. For the nurses, they have their own council, and the pharmacists, they have theirs. Now, each of these bodies have the mandate to regulate practice of those who are licensed. In fact, I must mention here that there are so many people, so many professionals who are practicing and are not licensed by their respective bodies. And unfortunately, this situation happened with Mohbad, but I believe this is a wake-up call for individuals to take responsibility for themselves. If you're not feeling well, go to the hospital and ensure you're going to the hospital where these individuals are licensed with their respective bodies. You must take ownership of your health. So there are different regulatory bodies that manage, the practice of medicine depending on which specialty, for the medical doctors, for the pharmacists, for the nurses. I know that they try to do one or two, but I mean, what this shows is that their reach is not wide enough.
All right, all right. And finally, the World Mental Health Day is coming up, even as it's a day that is celebrated all through the month of October. What or how will you draw the line? Where do you think the line should be drawn, between the circumstances around Mohbad's death and the mental health situation in Nigeria? How can you relate both incidents?
Yeah, from the early days of after his demise, there's been a lot of conversations around him having suffered some form of psychological illness or psychological disturbance one way or the other. And the World Mental Health Day, which is on the 10th of October, is focusing on mental health being a fundamental human right. And this is to show that, and for us as Intercept Consortium, we have a program coming up on Thursday, which is focusing on mental health, my responsibility. And we are trying to sensitize the public to know that it's not enough to see someone going through something and leave them be. We must, take care of ourselves. So it is your responsibility to take care of your mental health, but it is also your responsibility to be mindful of the mental health of your neighbor. So if the other person is going through something, let's not leave one another, suffer by themselves. Let us be involved in caring for each other. So we all need to hold our hands together so that we take care of our own mental health and then take care of the mental health of others, which is going to be the focus of our conversation on the on the 12th of October, marking the World Mental Health Day. So, with regards to your question, in as much as new things are coming up with regards to investigation, which I believe even more things are going to come up. But coming from the fact that he was going through something psychologically and nobody really said anything until his demise, it's very sad. So we need to pay attention to one another and make sure that if we see someone suffering, we should help in getting the help. We should make sure that that person gets the help that they need.
Thank you very much, Dr. Abiola Buremoh, for your time. She's a consultant psychiatrist.